I've been recently working on something that's kind of funny, but it sort of fits with what we're going to talk about today, which is I noticed that at the very, very, very beginning stages of getting sick, that there's a very specific feeling to it. And it's a subtle thing, so let me try to describe this. It's normally on a normal day, any given day, I feel internally like if I just close my eyes and check in with how my body feels like physically, it's reasonably quiet, but when I get sick, in the very beginning stages of getting sick, and it just gets worse as the illness progresses. But at the very beginning stages, I kind of notice this like buzzing, kind of vibrating sensation. If I just close my eyes, it's subtle, but I definitely notice it. And it's a funny thing that if I work on just clearing it out of my head, and this is sort of a meditation, right? I mean, in a sense, but you're learning to control your own chi, right? So maybe this is the beginning stages. This is the beginning stages of like a wind cold sort of thing. So this sort of wind thing is sort of trapped on the exterior, but for some reason I experience it physically as, whatever other symptoms may or may not be going on, I experience it physically as kind of this buzzing sensation in my head. And if I just take some deep breaths, kind of breathe out, then I notice that I can kind of get my head to be quiet, so to speak, so that the vibration isn't occurring inside my head. And if I'm really on it, man, I can get it to get out of my whole body. But I notice that if I can at least get it out of my head, I can get it to where I don't get sick. And it doesn't work every time, because I can admit that I'm kind of crummy at meditation. My concentration skills are kind of weak. If they were better, I could probably dodge every single cold. And if I can get it out of my head, then generally that's the end of it. But definitely if I can get it out of my whole body, but that's a tall order. Just getting it out of my head is actually not that hard. I actually woke up in the middle of the night a couple of nights ago, and this is why I was thinking about it, with a chest cold, which is pretty normal for me. I've said it before, my lungs are kind of a weak spot for me. So having colds go into my chest all the time is a pretty standard deal. But the other night I woke up with a chest cold, and then I just was like, I got I got stuff to do. I can't get sick, So I just laid there for like a while in the middle of the night, just like concentrating, meditating, getting that buzzing sensation out of my head. And then it would go away. I could get it to kind of go back. I would fall asleep and I'd wake up again. It would be back and I would make it go away. I woke up in the morning still with the chest cold a bit, and I worked on it through the day. Just like anytime I had kind of a spare moment, I would just kind of close my eyes and work on getting that feeling out of it. And it really worked again, that I didn't end up catching a cold, which is why I can speak to you now. So anyway, something to think about, and the reason I was thinking about this is because I'm about to spin out a case study for you here, which is something I was thinking about, is kind of like pulses, and the connection between this sensation that I get of this kind of like vibration sort of feeling, and it's kind of like it's a weird experience, but it's kind of like it kind of is like a tightness feeling inside me, like this kind of clenching sensation, like I'm sort of contracted in some way. And what's funny about it was I've been doing this for a couple of years, kind of working on this, trying not to get sick thing. And it recently kind of dawned on me for some reason that there might be some connection between this kind of contracted vibratory feeling that I get and a tight pulse that we sort of associate with when cold, and sort of differentiating a tight pulse from a wiry pulse, right? And sometimes you can only really differentiate it because, the person isn't otherwise a wiry type, or the pulse is more wiry than usual, and there isn't any like major, liver things going on. And I don't tend to feel like a wiry pulse just comes up out of nowhere. The wiry pulse takes time to kind of get going. So sometimes, they say, oh, you might confuse a tight pulse and a wiry pulse. And the tight pulse for me can come out of nowhere, where the pulse just feels a little contracted, and there's this kind of energy to it. But wiry pulse is a little different. That takes a while to get rolling. So let me spin out this case study, and I'll use it as a launch pad for talking about pulse a little bit. I had a 15-year-old girl come in. Her mother came in, brought her in, and described a situation which is quite unique. That every time the 15-year-old would like kind of be out. Okay, so it was mostly happening when she was outside, the weather was a little hot, and specifically she'd be working in the garden, and it would cause this yellow film, in a sense, to go over her vision. And she would get this kind of yellow film over her vision, and that it was not it was somewhat unpleasant, but at times it would cause her to almost kind of like lose sort of consciousness, in a sense, in where she would actually, one time her father carried her into the house, and she had no memory of getting picked up, carried into the house, and kind of came to in the house. But normally it just sort of exists as this yellow film over her eyes, and it just casts a yellow coloration on all of her vision. And it's, again, it's not entirely pleasant for her, but she has a hard time describing how it feels. It's sort of headachy, it's sort of disorienting. I would say disorienting is the main thing she describes here about it. And this has been going on for 3-4 years, and it's been getting a little bit worse. And she's getting to an age now at 15 where she wants to get a job, she wants to start working on getting her driver's license, she wants that independence. And it's not just her family, but she feels uncomfortable having more independence, maybe, say, for example, driving, and then having a consciousness issue arise around that, so she's worried, family is worried about it. So in the last 3 or 4 years, this has happened upwards of once a week, especially in the spring and summer when it's a bit warmer. But even in the winter, she'll notice it a bit more when she's tired, for example. But in the last 3 years that she's had this whole thing go on, there's only been a couple of times where she's kind of legitimately lost consciousness. So of course, they took her to the doctor and had a full neuro workup, and everything came back normal. They even hooked her up to EKG and EEG. Everything came back totally normal for her. She had MRIs in her brain of her head, and nothing to point to. The doctors just kind of were like, they sent her home. So now, as I said, it's getting to be more of a poignant issue for her in her life and where she's at, so they wanted to try to deal with it. The doctors had nothing to offer. I mean, they literally had nothing to offer. They were really up a creek about it. And so they came to me. And the thing about it was that, you know how it is somebody comes in with some bizarre symptom, we can usually connect the dots. That's the beauty of Chinese medicine. You can say, oh, well, how's everything else going? Oh, okay, this and that, but in this case, nothing was wrong. And when I say nothing, I mean nothing. Like, I'm good at this, like I know how to question. And it's like, there was just nothing going on, man. She's a good sleeper, no trouble falling asleep, no trouble staying asleep. She has good energy during the day. She has a good appetite, digests fine, the food's not getting stuck in there. She has, her bowel movements are fine, urination is fine. Her period, for God's sakes, is like perfect. It's like, very mild PMS, if, just very mild, and then the bleeding is fine, and she feels fine afterwards, and it's not really messing with her life. There was not much to point to here. All I could point to was there was some redness of her face, the skin on her face, and some blemishes on her face. That didn't, and the redness of her face didn't match the redness, say, or the coloration of her neck or her arms, or so something like that, where other parts of her skin that would get similar amounts of sun, they didn't look the same. There was very specifically redness. So of course, we think she's going through puberty, the kidney yang is increasing, so there's more heat in the system. But still, just because you're going through puberty and the kidney yang is increasing doesn't mean you're going to have heat symptoms rising into your face. It just means that if you bring any pre-existing heat to that situation, then you'll start to get those heat symptoms coming out more. So to some degree, there's a heat symptom here, but it kind of fits with where she's at in life and this and that. So, okay, fair enough. But I tell you, you just have to trust me on this one. There was nothing in the symptoms really to go on. So as far as signs is concerned, there was some redness in the upper body and the face, and not even in the neck, just in the face, right? Okay. The only thing that she had going on to me that was remarkable was her pulse. On the right side, it was quite weak, actually quite weak. It was a little surprising considering how good her energy levels are. The pulse was slippery, and quite so, in my estimation. I thought it was quite slippery. And there was a bit of an irregularity to it. Okay, so we have a rapid pulse. It's a little bit contracted as well. I forgot to say that. So kind of bordering on wiry-ish, but not quite there, and certainly she didn't have the strength of, the pulse wasn't quite strong enough underneath to warrant a true wiry pulse, but the pulse was contracted. Uh, and then there was a bit of this irregularity. Okay. Let me break down what I mean by all this and to kind of unpack this a little bit. So of course I'm saying the right side is a bit weak. So this weakness on the right side is a clear indication of this sort of spleen qi deficiency generally, kidney yang deficiency generally. Although her energy levels were perfectly good. On the other hand, her yellow coloration to her vision was somewhat worse when she was tired. She certainly could point to that. Oh, and let me say, there was no yellow coloration of the actual eye, nothing you could see, and it didn't come up. It was just subjective in her experience, not objective from the outside. So her pulse was weaker on the right side, quite a bit weaker on the right side than the left side. So we know what that means. The pulse is quite rapid. I mean, for a 15-year-old, you expect the pulse to be faster than for a full-grown adult, in their 20s, let's say. But it was, even for a 15-year-old, quite rapid. So there's some heat. So we're saying, okay, there's some deficiency here. There is some heat here. But then I'm saying, okay, it was slippery. Okay. So what does this mean? My teacher had a really elegant way of describing what a slippery, how to understand what a slippery pulse feels like. And we have this saying or something, it's like pearls rolling in a basin, which thanks a lot, that helps. And he said, okay, pearls rolling in a basin, what they mean here is that the slippery pulse, like let's say there was a piece of ice on the table and you pressed down with one finger on the piece of ice and it slipped out from under your finger. This is what a slippery pulse feels like. So the pearls rolling in the basin, his interpretation of that, or at least the way he had been taught about it from his Korean teacher, was that the pearl rolling in a basin was meant to illustrate the notion of if you tried to press down on a pearl rolling around in a low friction environment or something, then the pearl would shoot out from under your fingers. And it's that sensation that you look for in a slippery pulse. So the way I kind of describe it is, most of the time when you're taking the pulse kind of, it sort of comes from the deep and hits all the fingers at the same time. You got the 3 fingers in the pulse there and the radial pulse there. The pulse comes from the deep and then hits up at all of them at the same time. All 3 fingers at the same time. But here with a slippery pulse, you'll notice it'll give you the distinct impression that it hits each finger in turn. So it'll hit your ring finger, it'll hit your middle, and then the index. That's the distinct impression you'll get from it. It sort of slides by or something. I don't know what the word is here. But that's the sensation you'll be looking for. And what's amazing about it is, even if you just put one finger down on the pulse, you still get that sensation of it kind of sliding by your finger. It almost hits one side of your finger and then the next side of your finger next. This is what a slippery pulse is, and this is how I was taught to understand pearls rolling in a basin. So hopefully that makes sense. It's kind of, rather than coming from the deep and coming up and hitting your fingers, it really does come from the side. Like it comes from the proximal and goes to the distal. Like you feel it going side to side through your fingers. You kind of feel it slip under your fingers there, like something slipping away from you. Like something like that is the sensation. Of course, pulse is so subjective. It's hard to unpack this stuff. But this was how I was taught to understand a slippery pulse. Okay. So, and the thing is now that I've said it, once you have the experience of it, there will be no going back. You'll instantly get it. You'll understand it, and then it'll forever be yours, so to speak. So, okay, so that's a slippery pulse. And of course, for us, the slippery pulse generally, especially in this case, kind of fits with the previous aspect, which is that the pulse is relatively weak on the right side compared to the left side, actually quite weak. And then the slipperiness there, so it would speak to this kind of spleen deficiency with some dampness. I realized I just forgot to tell you, one of her things was that it also is worse to some degree when the weather is humid. So this would all fit. The weather's hot, the weather's humid, she's a bit tired, and then this is much more likely to happen. Okay, but it doesn't have to be. She could be at school and it's in air conditioning and it can happen. And she can't get any sense of a rhyme or reason around it. It's not related to stress at all. So I did observe in her personality, though her personality is a little hard to pin. She and her mom both say she's not a frustrated type particularly. She's not, she's a pretty easygoing kid. She's a pretty relaxed kid. Although in her face, just talking to her, you could see that she does hold on to some stress. And in the course of conversation, I ended up kind of saying something of that nature, like, look, like there are some signs here that you are holding on to stress to some degree. Does that sound reasonable? And she was like, eh. And her mom was kind of nodding, like, yeah, I would say so. She kind of holds on to stuff a little bit more than she should, but not enough that it was making her irritable or angry or frustrated or obstinate or, all these things that we associate with liver chi stagnation just wasn't there, so normal, right? As far as I'm concerned. Now, the other side of the pulse that I had described to you was that it was a little bit inconsistent or uneven in some sense. And in her case, it was, I would call it, what do we call it? It's sort of inconsistently inconsistent, right? This notion, irregularly irregular. So now normally we're thinking of these pulses as some kind of dire thing, like, oh, if you feel an irregularly irregular pulse, the patient's, has 3 days to live. And my teacher had a different view on this, that there are many, many cases where you can see irregular pulses that are actually more related to liver pulses. Okay, so let me unpack it a little bit here. So the typical pulse that we associate, of course, with liver chi stagnation is a wiry pulse, right? And so a wiry pulse is thin and it's firm, right? So you can kind of roll your fingers over it like a guitar string or a bowstring. You could literally move your fingers from side to side on the pulse, rolling over the pulse and feeling all the edges of it. And this is an indication of this contraction of the tissue. Remember in a past episode, I was kind of unpacking my notion of liver chi stagnation as being related to muscle contraction, right? So liver chi stagnation as having at least a relationship in an integrative way to muscle contraction, and I mentioned the wiry pulse as a part of this. Because when you deal with the liver, I think this long-term kind of contraction occurs, and that this is occurring at the level of the pulse, where the smooth muscle lining of the blood vessels there is also contracting and pulling the pulse in. But I don't really, it's not so much my experience that this like happens overnight, like some terribly stressful thing occurs and then it really is suddenly more contracted. I think it can be to a degree, but to be really wiry, I think this is a long road. If somebody has a wiry pulse, it's taken a while to get there. Because in a way, if the liver blood is strong, we say, then the liver is sort of emoliated. The liver is lubricated. So when there's a lot of liver blood, when there's the fullness of liver blood, then it's hard to get chi stagnation because everything is kind of oiled. So things keep moving. The chi doesn't stagnate. It keeps moving, moving, moving. And so in that case, then when there's a lot of liver blood, you could have a lot of liver chi, but you would be able to sort of weather a lot of stress, insult, so to speak. So stress, and the having all of that liver blood would mean that, yeah, you have the stress, but you also are able to kind of deal with it. The pulse, the blood kind of keeps you relaxed. It keeps, the blood houses your shen. It keeps your shen calm, but it keeps the chi moving. It does these multiple things. So it's sort of like when you start to run out of blood is when you really start to see that wiriness come in, because in a way I feel like the fullness of the blood doesn't allow the vessel to contract very much. That's my feeling about it in a sense. Now, of course, enough liver chi stagnation, I don't care how much blood you have, you can get a nice, strong, wiry pulse that's well contracted against the fluid in there. But it's sort of like hydraulics or something. It's like the fluid in the pulse keeps the vessel from contracting, from compressing. It just sort of forces it out. It keeps it open. You just can't close a system, right? So, but at some point, when you start to get enough blood deficiency, then the wiriness can really start to show itself. Because by definition, a wiry pulse is thin. It's a relatively thin, wiry pulse. So for example, you could have like a soft pulse, which indicates chi and blood deficiency, and it's almost like it's not there. You can't feel the vessel at all. You feel the pulse going through, kind of, but it's really weak. And you can't roll your finger over the vessel. There's no edge to it. On the other hand, you have a thin pulse, which is also a blood deficiency / chi deficiency pulse. But here, the pulse, instead of staying wide open, indicating probably more chi deficiency, yang deficiency, the pulse has contracted a bit. So it's thin, it's contracted around this lower volume, and yet it's not wiry yet. So a person can have a thin pulse that's not firm, that doesn't resist pressure. They could have a thin pulse, then the minute you step on it, it just disappears on you. This is this blood deficiency pulse, but it does not an indicator of chi, it's not an indicator of chi stagnation. Whereas the wiry pulse is both thin and hard, firm, sort of edgy. So then this would be sort of a differentiating factor here between some of these different pulses. Okay, so that's a classic wiry pulse, and I'm not arguing that she was at a medium wiry pulse, not even medium yet, but it was somewhat contracted. I can feel the edges a little bit, 20%. But what she did have was another form of pulse that is an indicator of chi stagnation. And this is something that my teacher taught me about, that I've found to be true across the board. I mean, it's really changed. In a way, it kind of changed my practice. It really changed my view on some things, or at least opened up my ability to identify chi stagnation when I wasn't before, which is to say that there's kind of two other pulses, in a sense, that indicate liver chi stagnation, which is an irregularly irregular pulse and a regularly irregular pulse. Okay, so the first one is this pulse that irregularly irregular, and what I mean here is that the pulse will do stuff like it'll skip a beat or half a beat or something. It'll be going along its normal trajectory, and then suddenly it doesn't beat. It's like there's a delay in the beat, and then it kind of catches up a little bit. Suddenly it delays for a nanosecond, and it sort of get this delayed beat, and then it might have some actually accelerated beats right afterwards, and then it kind of stops, and then it might come again, and then it might go again. It's there fairly consistently, but it's not a regular irregularity. It's not consistently. You couldn't count off a beat to it. It's sort of it does this slow down, this little delayed beat, sometimes not, and you can't, it's not consistent, like 3 good beats and then a delayed beat, and then you could metronome it. It's not like that. It's irregular, but it comes and goes. And what you'll notice in that situation is that it's actually, what you'll notice is that it's regulated against the breathing. So if you can split your attention and pay attention to the pulse rate, consistency, and then watch them breathe, you'll notice that they're actually sometimes doing some sighing, and that the sighing actually causes the thing to change. It actually causes it to change to some degree. So in that case, this is considered a chi stagnation pulse, but the chi stagnation is not the primary driver of the irregularity of the pulse. There is chi stagnation here, but there's also lung deficiency. And in this case, it's the lung deficiency is probably is more important or as important as the liver chi stagnation in this situation. If you're not sure if it's this type, ask the patient to take a deep breath and blow it out, and you'll see that their pulse changes with the breath quite dramatically. And this is an indication that the liver qi is stagnant, but that the lung qi is weak, because the lung qi should naturally regulate the pulse. It shouldn't, just taking a deep breath shouldn't so profoundly change the rate of the pulse. The pulse should be more regulated in that sense. And so what this indicates is, like, for example, if we say, and forgive me if I said this in a previous episode, but if somebody is annoyed about something, they got in an argument with their partner, and then you would say something like, "Hey, go for a jog or something. You'll have some perspective after that. Go do something else, And it's like, go for a jog, and then this is darned if it doesn't work. You go for a jog and you come back, you're like, okay, I don't feel so mad about it. I kind of get it. I wasn't necessarily thinking about it, but I just feel better about it. And what we say in this situation is that you have to remember that the lungs are the driver of qi through the channels. So the heart is the driver of blood through the vessels. The lungs are the engine driving the qi through the channels. So if the lungs are weak, then it has trouble doing that. So if somebody has a liver qi stagnation event, they get in an argument with their partner, then basically they go for a jog and they basically ramp up their lung function so drastically that it just blows through, to some degree, the stagnation behind it. That's why you get people like, you get your patients who are like addicted to exercise to the point that they're like blowing out their bodies and stuff like that. I think to some degree that this is what this is about, that powering up their lungs, then they're blowing through that liver qi stagnation, so to speak. You're sort of hyperventilating your way to enlightenment or something. It's a pranayama, isn't it? Right? But this irregular pulse is an indication to me that both of these things are going on. The liver qi stagnation is creating this irregularity, but the liver qi stagnation, the lung qi deficiency to regulate the metal chopping the wood to keep it regulated is not occurring. And it's this imagery of the metal chopping the wood that actually brings us to what the way my teacher would describe this pulse, which was to say choppy. That this is what we call a choppy pulse. And that a choppy pulse is described, what do we say, as rough, or like a knife scraping on bamboo. And it's like, that doesn't make any sense. But the way that he was taught about this was that if you were to take a knife and place the sharp tip on the bamboo, let's say the bamboo's pointing up and up, so you're sort of holding it up, it's standing up vertically, and then you point the knife downward so that the sharp side is in a downward motion going against the bamboo. What you would likely get is where it would enter the bamboo a little bit, and then if the knife isn't that sharp, it might jump out. And then it hits the next section of the bamboo and jumps out again, and it kind of goes down the bamboo, so to speak. And this is sort of this scraping, so sort of. And but the spots where the knife is hitting the bamboo as it skips down the shaft of the bamboo there would be irregular. So it wouldn't jump at regulated spots. It was some jumps would be bigger, some jumps would be less, depending on how much pressure you're putting in, the angle and all these things. But this was how he described a choppy pulse, and that the choppy pulse was indicative of a liver qi stagnation situation, right? So I think this is a fairly elegant description of it. So then you have the regularly irregular pulse, which is every third beat, it's mildly delayed, and then it hits, and then it kind of speeds up to sort of catch up, but it's happening on a dime. I mean, it's happening like a metronome. You can count it off, you can count on it, you can count the beats between the skips. It's regular. in my experience, the irregularly irregular one is okay. It's common enough. You're really strengthening the lungs. This is like a liver 4 kind of thing, you know, strengthening the lungs, relaxing the liver. It's not so bad. You know, it could just be constitutional in a sense. It indicates weakness to me. But the regularly irregular pulse, for me, in my experience, is always worse. It's always an indication of much, much deeper traumas. This is something that I tend to see in older people. I've seen it in a little bit older kids, but this is something that I tend to see in adults, older adults. And it's always, without fail, it has always been an indication of trauma in the past. It's been an indication of a very stressed upbringing, a life dictated by stress. And it's usually enough where it's intergenerational. The parents put that stress and they put it on their kids even when they try not to. It's like genetic somehow. It's like strong enough that it becomes genetic or something, epigenetic. So it's, for me, the regularly irregular choppy pulse is quite a bit worse. It's an indication of something quite a bit worse. It's a much deeper pathology to me. So what we're talking about here is we're talking about a wiry pulse, as I described it, and we're really talking about 2 different kinds of choppy pulses, okay? Okay, now that I've said it, go and look for it and see if that's the case. The slippery pulse, like something's moving sort of sideways across your fingers. It hits one finger, then the next finger, then the next finger very quickly. It's like a brap, 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 rather than just hitting your fingers all at once. Bop, bop, bop. You'll feel it go by, like running your finger on a washboard. Brap, brap, brap. That's kind of what it sounds like in my head. Then you get the wiry pulse, and the wiry pulse is clearly an excess. It's clearly a contraction around of the musculature. It's clearly a contraction of the liver, so to speak. It's an indication of this contraction, and that it indicates that there's at least some amount of blood deficiency underneath the surface to some degree. As opposed to a soft pulse or a thin pulse, of course. And then we have 2 types of choppy pulses, these rough pulses we described, like a knife scraping on bamboo. Now that I've described it to you, these 2 different types of choppy pulses, go to your clinic and see if you notice it. And then if you have a different experience of it, I'm always curious to hear from you guys. This is kind of my favorite part of the thing, is sort of questions and comments and that kind of thing. Let me know what you find. Let me know if you're noticing the same thing that I'm noticing, or even if you, now that I've said it, you notice it for the first time, let me know. I'm always curious to hear from you. Okay. Oh, the yellow film girl you asked? I treated her with herbs for spleen deficiency. So I used herbs for spleen deficiency because my sense of it, based on her personality, was that was more the core issue, and based on the symptoms of the actual pathology. That it was it happens when she's more tired, and it's not at all stress related to their experience, to their knowledge. There was no stress related thing. So my thing was a little bit, the herbs, I'm going to follow the constitution, because I worry a little bit with deficiency type constitutions giving chaihu based formulas. Sometimes it's a bit hard for them to digest, and it just doesn't work that well for me. You know, I was describing that in the last episode. So in this case with the herbs, I wanted to strengthen that weak right side pulse. So I gave her something like a guipitang or something, whatever I had in there. Something to strengthen the spleen. The reason I like guipitang in this situation is that it also strengthens the blood, because then with the acupuncture, I'm treating her for what I deem sort of this liver qi stagnation / lung deficiency. So things like kidney 7, liver 4, kidney 27, palpating around in the lung channel would be a normal thing, but she didn't have any tight spots really, or any even painful spots in the lung channel, like lung 6 and stuff like that. Nothing there, no tightness of the chest or anything like that, like we talked about in the first episode. No anxiety, nothing like that. So, you know, kidney 7, liver 4, kidney 27. These would be sort of the core of my treatment. UB 13, UB 18, like this. Okay. Treated her for a month, and after a month, it's been significantly reduced. Although we are waiting here for spring and summer to hit, but the mom and the daughter both said that there's been a number of instances where they would have expected it to come and it didn't come at all. And then there were some instances where it did come, but it was very short-lived and not problematic for her at all. So we'll keep on with the treatment, and we'll see how things go as things heat up here in Southern California where I am, and I'll keep you guys apprised of that. But so far so good. She's, in a way, actually almost it's completely gone, but I'm not satisfied yet. I'll keep a tight rein on her and see how things go as the season progresses here. Okay guys, take it easy and bye.